Introduction. Clopidogrel is a widely used antiplatelet medication that helps prevent blood clots. It is especially effective in reducing the risk of heart attacks, strokes, and other thrombotic events in people with cardiovascular diseases. Commonly prescribed for conditions such as Acute Coronary Syndrome, ACS, Peripheral Arterial Disease, PAD, and Ischemic Stroke. FDA approved and considered bioequivalent to reference products, ensuring safety and efficacy. It is available as 75 mg tablets and is recommended for long-term cardiovascular protection. Mechanism of action. Clopidogrel is a prodrug that gets activated in the liver through a two-step enzymatic process involving CYP enzymes like CYP2C19. The active metabolite irreversibly binds to the P2Y12 ADP receptor on platelets. This action prevents platelet activation, inhibits fibrin cross-linking, thereby reducing blood clot formation. Onset of action. Platelet inhibition begins 2 hours after a single dose. A loading dose of 300-600 mg is often used for faster action. Its irreversible action ensures prolonged platelet inhibition, even after the medication is stopped. Side effects. Common side effects. Bleeding, for example, nosebleeds, gastrointestinal bleeding, bruising, diarrhea, rash, abdominal pain. Serious side effects. Severe bleeding, internal or external. Thrombocytopenic purpura, TTP. Rare condition causing blood clots and low platelet count. Allergic reactions, swelling, difficulty breathing, or rash. Can be safely taken with or without food, as food does not significantly affect bioavailability. Contraindications. Absolute contraindications. Active bleeding disorders, for example, peptic ulcers, hemorrhagic stroke. Known hypersensitivity to clopidogrel or its components. Relative contraindications. Severe liver disease that impairs drug metabolism. Use with caution in patients at high risk of bleeding complications. Not recommended for use in pregnant or breastfeeding women unless prescribed by a physician. Poor metabolizers of CYP2C19 due to reduced efficacy and higher risk of adverse cardiovascular events. Maximum daily dose. The standard daily dose of clopidogrel is 75 mg once daily for most patients. In cases requiring a rapid response, for example, acute coronary syndrome, a loading dose of 300-600 mg is used, followed by a maintenance dose of 75 mg daily. Exceeding the recommended dose increases the risk of severe bleeding complications without additional therapeutic benefits. Most popular international brands containing this generic Plavix manufacturer: Sanofi country, France; Clopidogrel manufacturer, Sun Pharma country, India; Ischemic manufacturer, Bristol Myers Squibb country, United States; Ceruvan manufacturer, Torrent Pharmaceuticals country, India; Clopidogrel manufacturer, Cipla country, India. Adverse events. Common adverse events: minor bleeding, for example, nosebleeds, easy bruising; gastrointestinal discomforts such as diarrhea or abdominal pain; skin-related issues, including rashes or itchiness; serious adverse events: severe bleeding, especially in patients with underlying bleeding disorders; thrombocytopenic purpura, TTP, characterized by small blood clots in the vessels; liver dysfunction in rare cases; use with food, can be taken with or without food, as food does not significantly impact the drug's absorption or effectiveness. Patients with sensitive stomachs may prefer taking it with meals to minimize gastrointestinal discomfort. Drug interactions. Drugs that increase bleeding risk: aspirin or other NSAIDs like ibuprofen; anticoagulants, for example, warfarin or heparin; thrombolytics, for example, alteplase; drugs that reduce effectiveness: proton pump inhibitors, PPIs, especially omeprazole and esomeprazole, as they inhibit CYP2C19 activity. Rifampin is a strong CYP enzyme inducer. Other interactions. Use with caution in combination with SSRIs, SNRIs, for example, sertraline, venlafaxine, due to an increased risk of bleeding. No significant interactions with food, though grapefruit juice might mildly affect metabolism. Important note: patients should always inform their healthcare provider about all medications they are taking, including over-the-counter drugs and supplements, to avoid adverse interactions with or without food. Clopidogrel can be taken with or without food, as food has minimal impact on the drug's absorption or efficacy. Grapefruit juice. While not a significant concern, it may mildly interfere with the metabolism of clopidogrel by inhibiting the CYP450 enzyme. For sensitive stomachs, patients experiencing gastrointestinal discomfort may take clopidogrel with meals to reduce symptoms. Pharmacology drug class, antiplatelet agent. Therapeutic use, prevention of blood clots in conditions like acute coronary syndrome, ACS, peripheral arterial disease, PAD, and ischemic stroke. Target action, reduces the risk of myocardial infarction, stroke, and cardiovascular death. Pharmacodynamics. Mechanism of action. Clopidogrel is a P2Y12 receptor antagonist. It inhibits ADP-induced platelet aggregation, preventing platelets from clumping together to form clots. Duration of action. Irreversible inhibition of platelets lasts for the lifespan of the platelet, approximately 7-10 days. Clinical benefits. Reduces the risk of stroke by 30% in high-risk patients. Cardiovascular death and myocardial infarction, MI, by 20%. Highly effective when used within 24 hours of a transient ischemic attack, TIA, or minor ischemic stroke. Pharmacokinetics absorption, rapidly absorbed in the gastrointestinal tract. Bioavailability, tilde, 50% of the administered dose due to first-pass metabolism. Metabolism, prodrug is converted into an active metabolite primarily by the CYP2C19 enzyme. Distribution, highly bound to plasma proteins, tilde, 98%. Half-life, active metabolite, 8 hours. Clopidogrel itself, approximately 6 hours. Elimination, excreted primarily via urine, 50%, and feces, 46%. Time to peak concentration, reaches peak plasma levels within 1 hour after oral administration. Chemistry chemical formula C16H16, ClNO2s molar mass 321.82 g per mole. Half-life, active metabolite 8 hours. Parent compound, approximately 6 hours. Melting point, 125-126 degrees Celsius. Solubility, slightly soluble in water, freely soluble in organic solvents like methanol and acetone. Organic molecule class, belongs to the thienopyridine class of organic compounds, a prodrug that requires enzymatic activation in the liver. Bioavailability, approximately 50% due to first-pass metabolism. References, Plavix prescribing information, country, USA. Publisher, Bristol Myers Squibb and Sanofi Pharmaceuticals. Date, 2023. Key findings, detailed pharmacokinetics, safety, and clinical efficacy data supporting its use in cardiovascular risk management. European Society of Cardiology Guidelines, ESC. Country, Europe. Publisher, ESC. Date, 2023. Key findings, recommends clopidogrel as a first-line therapy for ACS, ischemic stroke, and PAD. Clinical pharmacokinetics of antiplatelet agents. Country, Canada. Publisher, Springer. Date, 2022. Key findings, comprehensive study on clopidogrel's absorption, metabolism, and drug interactions. FDA Drug Database, Country, USA. Publisher, U.S. Food and Drug Administration, FDA. Date, 2023. Key findings, approved bioequivalent studies confirming the safety and efficacy of clopidogrel. Handbook of Cardiovascular Drugs, Country, UK. Publisher, Oxford University Press. Date, 2021. Key findings includes insights on the molecular structure, pharmacodynamics, and global clinical trial results of clopidogrel.